Hi, today let's talk about straightforward, evidence-based natural strategies to support metabolic health, helping us lower cholesterol, control blood sugar, and manage our weight more holistically. Some of the foods that we will be talking about are also occasionally discussed in the context of dietary restriction mimetics, which is a group of foods that may help the body mimic some of the benefits of intermittent fasting, so I will be mentioning that briefly as well. So let's start with the first one, barberry. Barberry is a thorny shrub that's native to Europe, Asia, and parts of North America. Its small tarred berries have been used for centuries in traditional Chinese medicine and culinary practices across the globe. These berries are rich in bioactive compound, particularly berberine, which is a potent alkaloid renowned for its health-promoting properties. Historically, barberries were prized for their anti-inflammatory, antimicrobial, and digestive benefits. More recently, research has also highlighted their potential role in metabolic health. One of the benefits of barberries is their ability to help control blood sugar spikes after meals. In one study, the consumption of barberries was shown to have a comparable effect to metformin in lowering fasting blood glucose and hemoglobin A1C levels. For those of you who are not familiar with this medication, metformin is one of the cornerstone treatments for managing type 2 diabetes, the non-insulin dependent form. So I think that these results are pretty amazing. Barberries also help to lower LDL cholesterol. In this particular study, they looked at various metabolic markers, but I focused specifically on LDL, the so-called bad cholesterol. I wasn't specifically impressed with the hemoglobin A1C lowering effect, although there was some improvement. What really stood out to me was the significant reduction of the LDL cholesterol, which seemed to be due to the upregulation of the LDL receptors. In other words, consuming barberries appeared to help the body produce more of the LDL receptors. These receptors are the ones that pull the LDL out of the circulation. The more receptors our body has, the more cholesterol it can clear. The active compound in barberries, berberine, seems to be the one that's responsible for this effect. The LDL lowering effect of barberries was also confirmed in this systematic review of meta-analysis, which is another way of saying analyzing many different studies and seeing how many of these studies came to similar conclusion. Very rigorous evidence if the result of such analysis is positive. So looking at the result of this meta-analysis, if you ask me, almost 14-point lowering effect with barberries is pretty darn impressive result with this little dry fruit. The MD stands for mean difference, and it's a statistical measure used in meta-analysis to compare the average difference between two groups across multiple studies. In these studies, the MD was 13.75, which indicates that on average the LDL cholesterol levels in the treatment group, the group that received the barberry, was about 13.75 milligram per deciliter lower than those in the control group which did not receive the barberries. I already mentioned few of the benefits of barberries, particularly their ability to help regulate blood sugar and lower cholesterol. But it's also worth mentioning that barberries have been used in traditional Chinese medicine for centuries. Beyond their metabolic effect, they have also been used to improve acne, support arterial function, and even lower the level of triglycerides. However, and this is a very important point, barberries should be avoided during pregnancy because they may stimulate uterine contractions. The active compound berberine is believed to increase the risk of miscarriage, especially in early pregnancy. It should also be avoided while breastfeeding, since berberine can potentially worsen infant jaundice, which is the yellowing of the skin and eyes. And in more severe cases, it can also lead to a condition called kernicterus, which may cause brain damage. So, definitely avoid barberries in both of these situations. As I just mentioned, barberries contain compound called berberine. It's the berberine which has been shown to activate AMPK. I talked about AMPK extensively in my previous video, Aging Gracefully. But in a nutshell, AMPK is a key metabolic switch which is associated with increased lifespan in various animal studies. Now, what's exciting is that AMPK can be stimulated not only through fasting but also through certain foods, such as dietary restriction mimetics, and barberries are one of them. So what are these dietary restriction mimetics? Basically, they are foods that fool the body into thinking that it's starving and switch on the autophagy, the protective house cleaning mode. In other words, you get the benefits of the autophagy without having to either starve yourself or burn calories by exercise. Pretty cool concept if you ask me. Now, I would strongly caution against relying only on these dietary restriction mimetics, because paying attention to what we eat and staying physically active has far greater impact on many aspects of our health. But in combination with some physical activity and healthy eating habits, I believe that we can accomplish much more when we add them to our daily routine. And here is just one example of a study that supports what I've been talking about. Berberine really does appear to be one of the most effective natural compounds for activating AMPK among dietary restriction mimetics. And barberries are probably the easiest and most delicious way to incorporate it into our diet. But barberries are not the only herb that contain the active compound berberine. Other berberine-rich herbs include golden seal and oregano grape. These herbs are quite bitter though and are typically used for short-term in herbal medicine as part of targeted formulas for specific conditions. For example, golden seal is often used for upper respiratory infection and is usually combined with echinacea. Oregano grape is commonly used to support liver function, help detoxification, and address certain skin conditions. We have been using barberries almost daily for about a year now. I usually add them to my berry shake along with mixture of other berries and herbs, while my wife enjoys sprinkling them over her oatmeal with other fruits and add them to her rice. Now, if you decide to try barberries, here are a couple of practical tips. You can easily buy them online, but it's important to store them in a freezer. Large quantities are really prone to infestation by small fruit flies, no matter how airtight the container is. Freezing also helps to preserve their vibrant ruby red color, which can otherwise turn brown over time. Now, since barberries are quite dry, we recommend soaking them in a water overnight in the refrigerator after washing them thoroughly. Now, that's how we prepare them, but feel free to explore other ways to incorporate them into your own routine. Now, the dosage that was used in the clinical studies equals pretty much to about 1 tablespoon 2 times a day. But in my personal experience, 1 tablespoon or about 10 grams a day is enough. And that's also based on my research, what I feel comfortable using long term. Let's move to another powerful food ingredient that can help us support our metabolic health, and that's black cumin. There is more than 1,000 papers published in the medical literature about black cumin and its health benefits. Black cumin has been shown to play quite significant role in promoting weight loss, lowering the bad LDL cholesterol, triglycerides, and even controlling blood sugar. But studies have shown that black cumin also helps to lower markers of inflammation, such as the C-reactive protein, which means that it can be helpful in managing a variety of inflammatory conditions, such as asthma and rheumatoid arthritis. When it comes to treatment of obesity, looking for example at this study, individuals who consume black cumin lost on average about 2 kilograms, which is about 4.5 pounds. Now, this may not seem substantial on its own. However, even modest weight loss of just 5% in overweight or obese individuals can lead to significant improvements in important health markers like blood pressure, blood sugar, cholesterol levels. And all it takes is adding a little bit of this spice into our daily meals. I think that's a pretty good deal. That said, it's important to keep things in perspective. Even though studies like this show promising results for weight loss, this should never be seen as a magic spice that will melt pounds away. Successful weight loss still depends on the basics: a healthy diet and regular physical activity. Things like black cumin and other foods that I mentioned in this video should be viewed as additions that supports your effort, not a substitute. So yeah, just to be clear, I don't want anyone walking away from this video thinking that this is some kind of a magic fix. That's really not the message here. Now, the effect of black cumin on weight loss is great, but I was mostly impressed with the ability of black cumin to reduce cholesterol. Here you can see that the LDL lowering effect of black cumin was almost 14 points. The weighted mean difference WMD of 14.10 mg per deciliter in LDL reduction, which was reported in the study, represents more precise estimate of the difference between the treatment and the placebo group. The WMD basically accounts for the size and precision of individual studies that were included in the analysis, giving it more weight to the larger and higher quality studies. Therefore, it provides a little better indicator of the overall effect and its potential clinical significance. Now, here is another meta-analysis showing impressive 10-point LDL reduction. So what I'm trying to show you here is that black cumin can be quite helpful in reducing LDL cholesterol. So how much of the black cumin do we have to consume daily to get these benefits? Actually, it's pretty easy to add it to our diet because all it takes is about a quarter teaspoon a day. And you can mix it into any one of your meals. You will hardly taste it in it. Now let's continue our talk discussing hibiscus tea. Hibiscus tea is an herbal infusion made from the dried flowers of hibiscus plant, which is native to Africa, but these days is basically grown all over the world in tropical and subtropical regions. Now the tea has a nice tart cranberry-like flavor with a hint of natural sweetness. I personally love putting it as a base to my mixed berry shake, which I already mentioned, because it really enhances the flavor of the shake, especially when I combine it with some strawberries and few real cranberries. Now, hibiscus tea has been consumed for centuries, primarily in a region such as North and West Africa, but also in the Middle East, the Caribbean, and Asia. In ancient Egypt, for example, it is a popular beverage for refreshment and medicinal purposes, and supposedly it was one of the favorite drinks of the pharaohs. So hey, if it was good for them, it's definitely good by me. Now, one of the benefits that we get from drinking hibiscus tea is that it has been shown in several studies to be effective for weight loss. Research shows that drinking hibiscus tea can help reduce the formation of new fat cells and improve how the body processes and burns fat. This effect happens through activation of AMPK, which plays a key role in energy regulation, basically helping our body switch from storing fat to burning it. So it's really not surprised that hibiscus tea might support weight loss if it boosts AMPK activity. And naturally, that could have a ripple effect on all the other health issues that tends to come with obesity. In this particular study, they found that hibiscus extract was not only effective in reducing obesity, but also in improving liver health by addressing conditions like liver steatosis, which involves the buildup of excessive fat in liver cells. This is something that I discussed in more details in the video called Aging Gracefully. So if you did not see it, the link is in the description below. So how much weight can people actually lose by drinking hibiscus tea? Well, in this study, the group drinking the hibiscus tea lost about 8 pounds compared to 5 pounds in the placebo group. But hold on a second, that's just an extra pound a month. Yes, but still, that's 1 extra pound lost on the same calorie diet just from drinking tea. Not bad if you ask me. So, how much hibiscus tea has been shown to have some positive effect on weight loss? Well, in this particular study, the researchers used what I think is pretty reasonable dose. The participants were drinking about a cup and a half of the hibiscus tea a day for about 2 months. And just speaking from personal experience, it really does seem to work. Few of my patients did tell me that they noticed some difference. So yeah, I think it's definitely worth trying as part of the healthy weight loss program. But hibiscus tea has also been shown to have some promising result in lowering blood pressure. And in my personal opinion, this is even more important sort of side benefit of drinking hibiscus tea. So what's the story with hibiscus and blood pressure? Well, here is where I think it's really important not to misinterpret the findings or overstate what hibiscus tea can actually do. We need to be clear about the role that hibiscus plays when we are thinking about it as part of a larger blood pressure management strategy. So, how does hibiscus help lower blood pressure? Well, it's believed that it helps to lower blood pressure because it contains compounds that act as natural ACE inhibitors, which is a group of medications like lisinopril, captopril, and all the other so-called prils. Their main effect is to relax the blood vessels and improve blood flow, which is what helps to lower the blood pressure. But besides that, hibiscus also reduces oxidative stress and inflammation, which are also associated with hypertension. Now, would I recommend anybody with established hypertension to drink hibiscus tea to control their hypertension? Absolutely not. But I might suggest it to someone who has borderline hypertension and who is not yet candidate for blood pressure medication and whose blood pressure can still be managed with lifestyle modification. In this case, adding drinking hibiscus tea into the overall lifestyle modification program to manage hypertension might be something to consider. Okay, so let's talk about apple cider vinegar, which could be another great addition to our arsenal of foods for supporting metabolic health. I personally wasn't a big fan of apple cider vinegar for a long time, but I'll be the first to admit that this was largely due to my own ignorance. I had never really taken the time to look into it deeply enough to see if any of the claims people make about it are actually backed by science. While I still don't believe that all the hype is true, there are some benefits that I now feel are actually well substantiated. There are two main reasons why I added apple cider vinegar to my daily routine, and one of them has to do with being AMPK activator. Apple cider vinegar is not as potent AMPK activator as, for example, berberine, but it still can add up. But even stronger reason for me to add apple cider vinegar to my daily routine is its ability to control blood sugar spikes. Back in the day, apple cider vinegar wasn't just used for weight issues. It was actually one of the earliest folk remedies for diabetes, way long before we had any medications to treat it. But it wasn't until 1988 that this idea was actually tested in research study. And honestly, it's not hard to see why. Apple cider vinegar is cheap. There is not that much profit to be made in studying something that you can buy for a few bucks. So not exactly big priority for the big pharma. There is actually a growing number of studies, some stronger than others, that show pretty solid potential for using apple cider vinegar to help prevent blood sugar spikes after high carb meals. And this actually seems to apply not just to people with diabetes, but also those with prediabetes. In this study, for example, participants who were prediabetics took about 2 tablespoons of apple cider vinegar mixed into a drink each day. Within just 1 week, their fasting blood sugar dropped by an average of 16 points. That's pretty big deal. So how does apple cider vinegar actually help with blood sugar control? Well, there are a few ways it seems to work, but one of the ones that get talked about the most in the studies is its ability to block certain enzymes, especially the alpha amylase enzyme. This enzyme is what helps to break down the complex carbs into glucose, and when it's blocked, the carbs get absorbed into our bloodstream more slowly. But there is more to it. Apple cider vinegar also seems to slow down how quickly food leaves the stomach and enters the small intestine, which is a process called delayed gastric emptying. This means that carbs from our meal enter the body more gradually, which helps to prevent those sharp blood glucose spikes when carbs hit the bloodstream all at once. Personally, this was the reason why I started using apple cider vinegar myself. Now, I have to add one quick note of caution. If you have gastroparesis, which already causes slow stomach emptying, this might not be a good option for you. But again, it's really important to understand that using apple cider vinegar does not replace healthy, balanced diet or medication for diabetes if they are already needed. But again, as it has been shown in many studies, it can be a great addition to overall healthy management of type 2 diabetes or prediabetes and possibly weight loss as well. So here is a really cool study that I came across. Researchers looked at what happens when you combine apple cider vinegar with metformin. And guess what? The combination of apple cider vinegar and metformin worked better than metformin alone. That actually suggests that the two might have additive effect, probably because both help to activate the AMPK. And the metformin dose used in this study was actually on the lower side, so that makes it even more impressive. But before anyone thinks of trying something like this, definitely talk to your healthcare provider first. Even though metformin doesn't usually cause low blood sugar because it doesn't stimulate secretion of insulin, instead it helps the body to use insulin better. Adding something else also impacts glucose, and that can still be a risk. So, if you are taking medication, definitely talk to your provider and check your blood sugar regularly if you decide to experiment. I've been using apple cider vinegar before all my main meals, breakfast, lunch, and dinner religiously for over 6 months now. And honestly, it's been a total game changer for me. I do wear a continuous glucose monitor, so I have actually tested this, eating the exact same meals with and without apple cider vinegar, and yep, it really does help blunt those blood sugar spikes. So let's talk about how anyone can start using it. First, I wouldn't go over the 2 tablespoons a day. Personally, I use about 3/4 of a tablespoons or roughly 10 ml, no more than 15 minutes before each meal. The reason you want to split it up like this is because the active compound, the acetic acid, is metabolized pretty quickly. So you do need to have it in your system right before the meal to actually benefit from it. And yes, those 2 tablespoons a day seem to be enough. Studies even show benefits for reducing belly fat at this dose, but I'm still a bit skeptical on this one. But regardless, going with higher dose like 4 tablespoons a day was shown to be safe in research, but there is really no need to overdo it. Now, here is the part I really want to stress. Never ever drink it straight. I hope it's common sense, but still, it's a bad idea. It can trigger intractable hiccups, but more so, it will really burn your esophagus. Now, how about those apple cider vinegar tablets? Honestly, I don't recommend using them at all. If one of those tablets gets stuck in your throat, it can really cause damage to the esophagus. Plus, some of them don't even contain any real vinegar. So what I do is I mix the vinegar into a cup of water or any other sugar-free drink and drink it before the meal. Then I follow it up with at least few sips of plain water. Now this final step has made a big difference for me because I started to get mild heartburn after a couple of months, and once I added that rinse step, it completely went away. So again, dilute it, drink it right before your meal, and follow up with a little bit of plain water. That's it. Super simple but surprisingly effective. And that's what I have for this video. Hope it was helpful, and I will see you in the next one.